Good afternoon, ladies and gentlemen. It's a great pleasure to be on the stage again. Please join me in welcoming Engineer Dima Yahya. She's the Secretary General of the Digital Cooperation Organization, joining us for this session. So, Engineer Dima, thank you for making the time for us. I know you had an extraordinary, hectic, and very busy week in New York. But to start off, can you give us a little bit of a brief to understand more the work that you're doing in DCO, or Digital Cooperation Organization?
Oh, definitely. And thank you so much for having us here, especially in a very, very important and timely time in talking about healthcare and the digital world. If we go back in time, let's talk about digital economy, actually, and the exponential growth that we're seeing in this kind of economy. Last year alone, it was 16% of the overall GDP of the world, and expected in 2030, 70% of the GDP is going to be driven by digital solutions and systems. So that comes with abundance of opportunities for countries to diversify their economy. The thing is, to harness such kind of opportunity, you need to digitize and digitally transform. And that's a huge agenda, from infrastructure to reforms, policy regulations, talents, attracting investments, and so on. And yes, one country can overtake all of that, but it needs time and capital. Do we have the time? We don't have the time. And this is where cooperation is really important. A competitive advantage in a country could be a solution for a challenge to another country. And therefore, like-minded nations came together and decided to create a platform. And this platform, the essence of it is to accelerate their digital economy by sharing best practices and helping each other in their growth and prosperity. So therefore, the Digital Cooperation Organization was born in the essence of bringing in public sector, private sector, civil society, and financial institutions to work together to bridge the digital divide. Now, we represent 16 countries from Asia, Europe, Africa, and the Middle East, growing into 12 more, adding very soon, 800 million in population. That by itself is a huge market for any technology company to be part of. And what we're really focusing on is GDP and job creation.
Wonderful work. I've got the chance to review the DCU report for 2025. And in that report, it was looking into trends around the world and digitalization. And in one of the report, there was a graph about how likely certain sectors will be impacted by digital economy. And in the third place was healthcare. So could you talk a little bit about healthcare, and how do you see how are we taking strides in digitalization of the healthcare system?
Well, definitely. I just want to emphasize that in any sector that we look at using technology, there has to be a mindset, a certain mindset that we look at technology, which is technology is there as a tool to enable the sector and not the other way around. Technology should serve us. We shouldn't be following the technology. And this is specifically in healthcare. Imagine the danger when we look at technology as the leader in healthcare. So therefore, we really need to be focused in terms of how that technology would help us in terms of bridging gaps or solving challenges in healthcare that can help us in accelerating services to citizens, either within the institutions, the healthcare institutions, or even the practice itself, like identifying identifying new diseases and preventing diseases as well. So therefore, we do see that technology can definitely accelerate and enhance the way we are serving citizens when it comes to healthcare, but the risks are really also as big as the or as important to look at as much as the positives as well when it comes to healthcare. I would like to emphasize on many areas, but an area that is very much deep to and close to my heart, which is accessibility to healthcare. And this is where digital can really help and support in making healthcare accessible. Now, we are suffering from a huge digital divide. Now, 2.8 actually billion people in the world still are not connected. They don't even have internet connection. So imagine, they're off the grid, a blackout. And for that, exactly, it's so huge. And imagine in a lifetime that we're living right now where we're considering the internet as important as water and electricity. It's a human right. So such kind of nations, we need to look at how can we connect them? How can we bridge that digital divide to get healthcare? I would like to give an example of Rwanda, for instance. Rwanda, through COVID, they started using, which they are, by the way, 40% connected. They accelerate their connectivity through COVID to 90%. And they used drones to transfer blood, for blood transfer between cities. Now, a great example that we have in Saudi Arabia as well, which is the virtual hospital. Now, countries, the likes of Jordan, the likes of Palestine, and also now, recently, the likes of Tunis, are outsourcing their healthcare to Saudi Arabia, the virtual hospital, for specific kinds of treatments that these countries cannot afford to provide their citizens. So I always think, and this is our message actually here in ONGA and in front of the leaders of the world, is that where is digital from your humanitarian aid? Where is digital from your development plans? We have countries that are now coming out of conflict, like Syria, and that should put digital in the forefront of their plans. Yes, it's important to build the hospital, it's important to purchase the devices, but till then, till we get the brick and mortar done, let's connect. Let's connect hospitals to other hospitals in the world, doctors to researchers, and accelerate the serving humanity faster.
Amazing. I truly believe that there is a lot of people in healthcare that believe in digitalization. However, I think introduction of AI, people are a bit hesitant. You spoke a little bit about the mindset. And a lot of people, especially us in working in healthcare, were very driven by validation, accrediting bodies that follow us through. Patient safety is in the heart of all of this. So how do we encourage the adoption of AI? A lot of people have the fear that if AI develops further, we'll lose our jobs. So how do we make people more engaged in adopting AI in healthcare?
Well, definitely we do see, as techies, we do see that AI definitely will have a lot of positive impact economically and also socially, increasing efficiency, transparency, and also increasing the quality as well, either of work or either of also our personal lives. But again, going back to, it's a technology, it's a tool. We have to look at it as a tool that will enable our growth, a tool that will solve a challenge, not the other way around, which is using AI for the sake of using AI, especially when it comes into healthcare, because it is very tricky in this matter. And I was just talking to a doctor about my mother. She was going into the doctor, and after a lot of search on Google and asking her friend ChatGPT, she went into the doctor telling him about her diagnosis and asking him to write her a prescription of a medicine. And he was just looking at her and saying, you know, I studied abroad for 8 years, and I came back and I became a professor, and now you're asking ChatGPT for that. So we really need to know and build the awareness of when to use it and how to use the technology. And when it comes to adoption as well, it is a responsibility on also governments and institutions to put the right principles and put the right standards that will encourage the innovators and also the private sector to make sure that they're putting in safeguarding these exactly and regulations, safeguarding these technologies for the benefit of humanity. And it's very important to protect users in adopting such kind of technology.
Talking about safeguarding, now with the rise of social media, we see a lot of misinformation. And with social media becoming very accessible, very widespread, talking about your mom, I was telling Engineer Dima just a minute ago that my dad keeps sending me these like TikTok clips asking me to order all of these meds and creams because he saw this. So, and unfortunately, you just don't see it with the public. Also, you see professionals believing some misinformation that you see on social media. How do we protect the patients, protect our system from such misinformation?
Oh, definitely. This is a big challenge on a global level, and it's a responsibility of all the ecosystem. I would start with the governments. The governments, it's very important for governments to put in the right standards and principles that will protect their citizens against these platforms. Yes, these platforms have its positives. They create jobs, they build the awareness and knowledge, but at the same time, they have to safeguard their citizens. Another thing is the private sector or the innovators. They have a responsibility as well to make sure that their technologies are providing the right information for the people or their consumers. And then, last but not least, building the awareness into the citizens as well. And this is where we have launched a campaign within DCO, which we call the Race to Zero. And this is where we have tried to attract innovators to come up with solutions that can combat misinformation online and can detect misinformation and report it back and create the right mechanisms to prevent that. But I always would say is that when it comes to especially healthcare, it comes to the awareness of the person as well. Till now, technology cannot replace human diagnosis and human interaction and getting the right information from the right people.
So everybody be relaxed. Everybody's keeping their job.
Well, on the jobs, if you don't mind me,
sure.
Actually, because I forgot that point. And I'm asked always this question, is AI going to replace your job? Yes. Yes, it will. It will replace your job, but it will replace blue-collar jobs, and that will give us an opportunity to upgrade our jobs into white-collar jobs. So AI will introduce a new vast of new jobs. We know that with AI, we are going to look at more than 192 new jobs. Just looking at AI. So this is where it's very important on governments to work on upskilling. And when the conversion starts, which is the adoption of AI and upskilling people to become ready for new AI jobs.
And I think it goes back also to the individuals to work on developing themselves in that adaptation.
Oh, definitely. And that's a human nature.
Yes.
We should be continuously learning.
Well, thank you, Engineer Dean, for your time. We know you have meetings after this, so thank you for dedicating this hour with us.
No, thank you for having me.
Join me to thank Engineer Dean.